So we are doing IV push. Okay? So you're going to get a MAR. It's got a physician's order and a MAR sheet. Okay? I'm going to tell you your patient is Martha Smith. I want you to give her IV furosemide. We'll go ahead and start the competency.
Check medication order against original order.
So I'm going to check to make sure that I have Martha Smith, right date of birth, 2/5/55. The furosemide says 20 milligrams IV push daily. 20 milligrams IV push daily. So my orders match the MAR.
Check for allergies.
All right. Patient has a sulfonamide allergy. I'm not giving a sulfa, so I will be good.
Gather necessary equipment.
Okay. So I have Martha. I'm going to need some alcohol swabs. Let me move my drug book. Oh, here it is.
Oh, she didn't.
I'm going to need my drug book. And I have some flushes in here and her med box. Okay.
Read MAR and select proper med for medication supply system. Pick
Okay.
6 or Omnicell or patient med drawer. First med check.
So you will notice there is a bunch of meds in here. Okay, they are not all Martha's, they are not all furosemide. You will have to look through here and select the right medication and the right patient. That is Kelly. There's Martha, she's got furosemide. So when you do a med check, you do your 6 rights. So I got the right patient, Martha Smith, got the right date of birth. I got the patient, drug is furosemide, dose is 20 milligrams, IV push is my route. I'm going to give it today, and I will document later. Patient, drug, dose, route, time, and I'll document later. That's my first med check.
Compare label with MAR. Second med check.
Okay, I'm going to do the same thing. Martha Smith, right patient, drug is furosemide, 20 milligrams, IV push, 20 milligrams. Now this says 10 milligrams per 1 milliliter. So how many milliliters will I need?
2.
2. Okay, so I know I need 2 milliliters. It's IV push daily, and I'll document later.
Check expiration date. Check vial for clarity.
Okay. Make sure I have my syringe to draw it up. It is not expired, and my vial is clear. Okay.
Check drug resource to clarify whether med needs to be diluted before bolus administration. Calculate push rate.
Okay, this is where you'll need your drug book. So I know I'm giving furosemide. I'm going to open up my drug book because I already marked it to furosemide. And in here, you'll have your drug name. In this version of the book, it's under nursing implications, IV administrations. It says IV push. And it says administer undiluted, larger doses may be diluted, and do a concentration of 10 milligrams per milliliter, administer at a rate of 20 milligrams per minute. So if I'm giving 20 milligrams, I'm going to give it over a minute. Okay? So that's something you're going to have to tell your instructor. You will have access to a drug book. You can bring your own if you'd like. Okay? Say, I do not need to dilute it. It's going to go at 20 milligrams per minute. I'm giving 20 milligrams, so it will go over a minute. Okay?
Correctly draw up medication for order using sterile technique and verify its correct drug and dose with instructor.
So I clean the top of my vial off. I'm going to grab my syringe. I know I need 2 milliliters of the medication. So I'm going to insert 2 milliliters of air. Flip it. Get rid of my bubbles. I have 2 milliliters of my medication. I'm going to safely recap, showing my instructor that I drew up the correct med and it's the correct dose. They agree.
Enter patient room and introduce yourself.
Hi, Miss Smith. My name is Liz. I'm going to be your nurse today. Can I have your name and date of birth?
Perform hand hygiene. Confirm patient's identity using 2 identifiers.
Okay, so I checked her wristband for her name and date of birth. I'm grabbing some alcohol swabs. Okay. Got my name and date of birth. Patient, identified myself.
Perform your hand hygiene.
I washed my hands. Okay.
Explain procedure.
So what I have for you is I have your IV Lasix. This is going to go in your IV. I'm going to slowly push it in over a minute. And this is a diuretic, so it's probably going to make you have to pee. So go ahead and put your call light on if you got to go to the bathroom.
Provide privacy. Ask patient about allergies.
Do you have any allergies? I'm allergic to sulfa drugs. Okay, I don't have a sulfa drug, so we're okay.
Recheck the label with the MAR third med check.
Okay, your third med check has to be at the patient bedside. So I'm going to say, okay, I got Miss Martha Smith. Yep, she verifies she's Martha Smith. I got your furosemide, 20 milligrams, which is 2 milliliters. IV push every day, and I'll document it at the end. Does that sound correct to you? Yeah, she's great.
Assess IV site for inflammation or infiltration.
Always assess your site before we push something through it. Make sure it's not red, swollen, leaking. We gotta make sure it's a good IV.
Apply clean gloves.
Okay. Let me put my clean gloves on. Okay.
Clean injection port of IV with alcohol pad.
So I'm going to take the orange cap off, and I'm going to scrub the hub for at least 15 seconds.
Unclamp and stitch in tubing. Uncap saline flush syringe. Stabilize port with your non-dominant hand and insert saline flush syringe into IV.
Making sure you got rid of your bolus.
Gently pull it back on the syringe to check for blood return.
Okay. Making sure I got rid of my air bubble in there. I unclamp this. We gently pull back. You'll get a blood return. Now you might not have the plastic arms. Okay. And then I'm going to slowly flush it in. You at least want to flush 3 to 5 milliliters because that gets it all the way through the IV and into the arm. You're watching your patient for any signs and symptoms of a reaction. Does it hurt? Is it flushing okay? Okay.
Instill solution over 1 minute. Watch insertion site for swelling. Remove syringe when done.
Okay. So now I'm done with this syringe.
Wipe end cap with alcohol pad. Uncap medication syringe. Insert medication syringe into IV.
Okay. So now I'm going to clean it again. And I'm going to go ahead and say, okay, Miss Martha. Now I'm going to go ahead and push your medication. This is going to go in over a minute. So I have 2 milliliters to go in over a minute. So that means 1 milliliter goes in about 30 seconds. So that means half a milliliter goes in about every 15. Okay, so kind of keep an eye on the clock. If they're watching Jeopardy, you can play along with them. Now for competencies, you need to state the correct rate that you're pushing it in. You don't have to stand here for the full minute and push it in. Or in some cases, some of those drugs are over 3 to 5 minutes. Okay, so I need to hear the correct rate, and I need to hear if you need to dilute it. So we're going to say it's been a minute. Go ahead.
Inject medication at recommended rate.
Okay.
While administering med, observe for adverse reaction. If occurs, stop infusion and notify MD.
Okay, patient's not having a reaction. They're doing good.
Remove med syringe. Wipe port with alcohol pad. Insert saline syringe and instill flush solution at same rate as the administered med. When done, clamp extension tubing.
Okay. Now this second flush has to go at the same rate of the medication because there's still medication in this tubing that you're pushing. Okay. So if 2 milliliters went in over a minute, I was pushing about a quarter of a milliliter every 30 seconds, right? So I'm going to keep that same rate. All right, so I'm going to go ahead and flush. Every 30 seconds is going to be about half a milliliter. Patient's doing great. Again, you just have to state the rate to the instructor. Okay? We're going to make sure I clamp this tubing when I'm done flushing.
Remove syringe, apply disinfection cap.
Okay. Now I don't have to clean it this time because I'm going to put the self-cleaning disinfectant cap on.
Post-procedure, remove gloves, perform hand hygiene, discard equipment, return bed to lowest position, make sure call light within reach, document date, time, dose, route, patient tolerance, and patient education.
So I'm going to go ahead and put your bed down. She's got her call light. I'm going to document everything. So your supplies for that were you needed the medication. You needed 2 flushes. I needed at least 3 alcohol swabs, right? One when I took the cap off. One before my flush. One between the flush and the med. Another med and the flush. Okay? And then I need a second swab to put on at the end. And that's about it. You need your MAR to verify. That's your IV bolus. So once you start your IV, I'm going to give you a MAR, and then